Welcome to your Honor Health Tech podcast. This is David Powers, and we're introducing Dr. Arthur. Dr. Arthur, how are you doing today?
I'm doing fine. Delightful to connect with you.
Great. So I hear you are a well-known and well-researched doctor and white papers on urology. So what is the biggest thing with men's health these days?
Well, I hope that I'm an authority of some sort, having been a trained urologist and involved with men's health for, gosh, 40-ish years. What's the biggest thing? I think just helping men uh, stay healthy. Um, Certainly, there are advances with the erectile dysfunction therapies. There's advances with regard to prostate cancer management and helping men reconcile their sexual dysfunction after that. Those are probably some of the major topics to bring to discussion.
Gotcha. I know there's all kinds of drugs that we see out there, like Cialis and all kinds of other drugs for health and testosterone. What do you have an idea on those? Because I know that's widely seen by the public.
Well, yes, and I think it's important that we clearly define the nature of the sexual dysfunction in men, use the therapies where they're appropriate. We know that, for example, testosterone doesn't always correct erectile dysfunction. It may help with a man's sexual desire and his libido, but only if we check a testosterone level and that's found to be low and it benefits that man to have it perhaps managed to increase testosterone levels from a testosterone deficiency standpoint. That's
Right.
biochemically or confirmed. The oral medications, I think, have been revolutionary in the past 20, 25 years, but they don't work in everybody. And properly using the medications is key with some instruction to have the best benefit from them. And then if these oral medications are ineffective, well, we want men to know that there are some other options that can be pursued as well.
What natural things can men do as well besides
Well,
diet?
yeah, well, that's the thing that's you hit on it. I mean, what are the natural things? Well, the most important thing is maintain your general physical health and your cardiovascular health. That's tied directly to your one's erection ability and sexual health. That if you can be sure that you're maintaining a certain level of physical fitness, getting your proper rest, sleep hygiene, as we call it, in addition to the diet. And so these lifestyle and behavioral things really remain key. If there's a thought here about some sort of special supplement or vitamin or some other kind of herbal remedy, I'd have to say those things are really not proven, unfortunately. And I would encourage just good health foremost.
Wow. What kind of foods promote men's health?
Well, those kind of foods would be things like a balanced diet of fruits and vegetables, and the cutting back on some of these ultra processed foods that probably contain various chemicals and do affect one's cardiovascular and metabolic health over time. May contribute to weight gain and other unhealthful kind of changes in the body. So I think just more natural foods, fruits and vegetables, balanced diet, maybe cut back on excessive red meats. And maybe a good steak every now and then is fine, but otherwise try to, eat maybe some fish and chicken and things of that sort that are a little less likely to have some cardiovascular adversity.
Gotcha. So you would chicken and fish.
Yeah, yeah, try to balance your diet a little bit more.
Gotcha. So what have you seen over your 40 years of practice?
Well, what I've seen, I think, is just that we've made progress in so many different areas. I think that modern science and the medical field is evolving. We talked a little bit about how the erectile dysfunction is managed these days. Back when I trained here at Johns Hopkins 40-ish years ago, it was a very primitive way of just saying, well, try an herbal supplement Just it's all in your head. Get some counseling and just live with the situation. Well, I think obviously we've moved forward here with, I think, good understanding about the factors that are involved in male sexual health and the approaches to take with that, and also new therapies. And we just talked about the oral drugs that came about with scientific work done probably about 25 years ago. So we make progress in that area. For men's health in general, and prostate cancer is a big one, as sexual dysfunction consequences with treatment. We are going about better ways of managing that to lessen the complication risks. So I think there's just a whole host of areas in which progress is being made.
Well, that's awesome. Um, does weather and area environment have to change men's health?
Um, Not directly. I think that if people like to be outside and be physically active, when the weather gets too cold and you do less of that, I think that may be, how that association might be made. But I don't think we have any strong basis to think that weather in itself is a direct
Gotcha.
factor there.
So, what do you recommend going forward for someone, I guess, 45 plus? A lot of men below the age of 40 typically have a lot of energy.
Well, I try to encourage men to look toward these lifestyle improvement factors, pursue the best general health that allows you to preserve your sexual function as well as your overall physical health and your cardiovascular health. Um, Try to do the healthful things, including things that are as basic as just good sleep hygiene, getting your rest, the right diet, which we talked about. But also, getting a health checkup. Men ignore their health in general, and there's some things that we need to screen for with a real health checkup and some blood tests and things of that sort. Prostate cancer might be one where we do have a blood test called the PSA that should screen for that. But the discussion with your healthcare provider and understanding the potential risk, and various other kinds of things that might be learned, including family history of health and things of that sort. So just encouraging men to take charge of their health, get health
Gotcha.
checkups, and try to live a better healthful lifestyle that'll be,
Right. My
I think, really
grandfather
productive.
did a prostate surgery. He was 92. So I know a lot of people can't heal as quickly when they age in the over, I guess, over 70.
Well, that's true. And then we have to really tailor the right intervention for the right individual. I think we've gotten better in the field of prostate cancer management to really define the high risk types of prostate cancers. Some of the lower risk type, we might just say, let's just be more of a conservative about it in terms of a surveillance mode. We also want to understand a man's general longevity and health and whether there's other health conditions that may impact the best decision about what to do about that. So you can see, I think we're just getting more refined about our guidelines and recommendations.
Gotcha. Is there anything else you want to talk about men's health other than the
Well,
prostate?
Well, just that, and then and hopefully your listening audience will find this just general recommendations that we're stating here to be of benefit. Certainly, I do consider myself to be a bit of an authority. If people do look up any of my information that's on various media sites and books that we're putting out and about men's health, please do that. I think again, men take some self-responsibility. You can be in charge of your good health, and please do that.
So, what's your latest book?
Well, the book that I wrote latest came out about 2 years ago was The Manhood Prescription, Manhood RX. And we have a book that we likely are going to be coming out here within the year, also on men's health, a very basic text that go over some basic guidance for being a man, but also attaining your best health. And that one's going to likely be called Penis Confidential. That'll be an intriguing title to say, I want to read about that, but also really some real confidential consultation information from a credible person like myself to help give men best guidance with their health.
Well, if people can't get down to John Hopkins, I'm guessing that's where you are, correct?
Oh
Where do you
yes.
recommend in the Philadelphia area, if any?
Well, I mean, there's good healthcare providers at medical centers in the Philadelphia area. And so, yeah, there are major centers there, major medical centers. And I would certainly encourage individuals that are at those centers that I know of, but I won't call them by name, but just look those centers up and identify a good healthcare provider that makes sense to you.
Gotcha. Well, what is your favorite quote, sir?
Well, I think my favorite quote is things that are very basic. Uh, uh, never quit, and carpe diem, which is to seize the day, meaning that it's very important to live life to the fullest, and know that we're here for a finite period of time. So make life purposeful and enjoy every day.
We appreciate your time. How can we get in touch with you?
Well, I think the easiest way get websites. I think as the way things are done these days. Look up my name directly, Arthur Burnett, through the Hopkins website. But there's also information that other media sources, just using my name, you'll be able to
And
identify.
I'm guessing you can get his latest book on Amazon or whatnot, correct?
Oh, absolutely, absolutely.
Is there anything you want to close with, sir?
No, just again, thank you for having me join you. It's my delight to spend time with you, and I think we're doing a great service to your listening audience. I wish everyone the very best and have a happy holiday season.
You too. Thank you much. We would love to have you back on, sir. So get in touch with us, and we're always
Yes,
help the homeless.
absolutely. Glad to do so.
All right. Thank you much, and have a great day, sir.
Take care.